on WeFM, and Your Health Matters is hosted by Dr. Gerald Thompson and brought to you with the kind compliments of People's Pharmacy.
Your health matters.
How much do you know about what makes up a healthy lifestyle?
Your health matters.
How do you define good nutrition?
Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on BFM 99.9 because your health matters.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Hi, we're on.
Yes, Dr. Thompson. It's time for
Thank you very much, Kamal. It's always a pleasure on a Wednesday evening at 8 p.m. that you are reminded that your health matters. This is something that you should be aware of all the time. This program strives to bring you aware with some important topics that are not normally discussed. Health is so broad that there are so many things to talk about on a given night. Those persons who are listening may be thinking or concerned about one illness or another that's not being discussed. But we're trying to broaden your whole understanding of health as we know it, as we are learning and continually learning about it. As Kamal said, this is an interactive program in which you could call in at any time. Interrupt me. I am, again, out of the country, but I'll be back shortly in a couple of days. But Kamal will know when a call or a text is coming up. We want to encourage you to basically interact. Ask me the tough questions. Yeah, ask me the easy questions too. Ask me those things that are concerning you, and we'll try and answer. If we are not able to answer, we'll try and find a way of coming back at a later program, maybe not always the next program, and answering those particular questions. So remember, 457-9997. You could give us a WhatsApp message, give us a WhatsApp call, or you could call straight from wherever you are in North America, England, Central or South America, any other part of the Caribbean, any other part of the world, or whether you're right there in St. Vincent and Grenadines, North or South. We wish we could hear from you. If not, just sit back and listen. I know there's a number of people out there listening, and we basically are looking to be able to educate you on one program or the other. Now, this evening, I want to talk to you because I realize a lot of people don't always have an idea what kind of doctor they may be dealing with. And there's a topic I want to focus on today, but I want to start off by saying that there are really about 6 disciplines of medicine. And let me start off by saying, making it simple, there could be obstetrics and gynecology. The doctors who are able to look at a female reproductive system and help her through any kind of illness towards having childbirth and to continue her gynecology care and her obstetrics care, bringing the baby into the world. That's the first one, OBGYN, right? Now, there's another, so those are the childbirth doctors, the doctors who deal with women and women type of illnesses. They also deal with breast issues. They deal with issues of the ovaries, issues of menopause, issues of young girls having their periods. They deal with those kind of things. Secondly, if there are doctors who are dealing with childbirth, then once the child is born, right up from birth, right up to the age of about 16 or 18, you can have doctors who deal with very young persons. They're pediatricians. They deal with infants and children. They also deal with teenagers too. But teenagers start getting into an area of being adults. That's why I said between 16 and 18, and there's some difference there. But young kids, 7, 8 years, 9, 10, they will see a pediatrician, a baby doctor. Not the baby birth doctor, the baby doctor. Now, if there are women doctors, there can be doctors who deal with men reproductive organs. These are urologists. Urologists deal with the male organs, the male organ, his penis, his testicles, and so forth. He's often worried about one of the big illnesses happening today, prostate cancer or prostate enlargement or infections in relation to the bladder. Urologists deal with the bladder, and they also deal with the kidneys. They also deal with the penis and so forth. They're urologists. The fourth type is what we call the internal medicine doctor. This is a doctor who is now not a pediatrician, but an adult doctor. He's going to deal with persons from the age of about 16 or 18 right up until 100, 110, however long they live. And these doctors can specialize. So they're adult doctors, internal medicine doctors, but they're also adult doctors. And they can specialize into doctors who deal with nerves in the adult, neurologists, or doctors who deal with the lungs. These are called pulmonologists. Or doctor who deals directly, strictly with the heart is a cardiologist. Those who deal with the intestines, the gastroenterologists. Now, doctors who deal with the kidneys are called nephrologists. Nephrologists. They're not the same as urologists. They're nephrologists. They're dealing with the functions of the kidney. And then if there's a person dealing with the function of the kidney, then the joints. If there's somebody who's dealing with joints, they call rheumatologists. I'm talking about your knee joint and your ankle joint and your back and those other things. They are rheumatologists. And then there's the infectious diseases. These are doctors who deal with a broad array of infections. Then we have the dermatologist. He's dealing more directly with the skin. He's not dealing with anywhere. He can deal with the skin on the outside, maybe some of the skin on next to the inside of your mouth or the or other parts of your body that seem to be internal. Dermatologists could also deal with them. And then there are also doctors who deal with persons who are very elderly. These are persons who deal with the elderly, let's put it that way, specifically geriatric medicine. Now, that was number 4 and the subspecialties on the internal medicine. We shift now from doctors who deal with internal to doctors who are surgeons. Surgeons. Now, we all know a doctor who's doing surgery on the brain is going to be called a neurosurgeon, whereas a doctor who's a general surgeon will do all sorts of things. He's doing general surgery. But you can have a doctor who specializes in the heart, he's heart surgeon, or a doctor who deals with the skin. He's a surgeon, so we call it a plastic surgeon. And then we can have a surgeon who's dealing with the bones. We call them orthopedics. There's some doctors who deal with the ear, nose, and throat. We call them ENT surgeons or ENT specialists. and they're all different types of surgeons. And then there is an area called psychiatry. And this is one of the more difficult areas of medicine because it is not just dealing with the brain, or it's not dealing with the heart or the lungs or the kidney. It's dealing with really how the brain functions. You know, they're not doing any surgery. They're not dealing with illnesses that can affect the brain, like diabetes could affect the brain. They're dealing with the net result of how the brain functions. The psychiatrist, you can have adult psychiatrists, children psychiatrists. Now, having said all that, there's what's called a group of doctors called the family doctor or the general practitioner. They will do a bit of OBGYN, a bit of pediatrics, a bit of urology, a bit of internal medicine. They might even do some surgery, and they will do a bit of psychiatry, you know? And those doctors are very important. Could you
Doc,
imagine?
I see we have a caller here. I
Get a
don't know.
early call. Okay,
Yeah.
all right. Let's take the call early. Yes.
Good night, Doc.
Yes.
I have a problem that I encountered like just over a month ago. I fell from a ladder
Yes.
that landed on my right foot.
Yes.
Nothing not wrong with it until just about 2 weeks ago.
Yeah.
And then around the kneecap area start swelling and stuff like that.
Around the ankle, you said? Huh?
No, the knee.
Oh, the knee started swelling. But you let me ask you, did you fell on your heel or your ankle? Did the ankle seem to twist or anything like that? It didn't, did it?
No, I landed flat, but my right foot is what took the weight.
I see. And then you toppled over onto the side. Now, so what you're experiencing now, some swelling of your knee? Are you experiencing swelling anywhere else?
Well, the swelling was in the ankle and the knee, but the swelling gone down. But the problem is that the pain, the excruciating pain remains. Like when I'm climbing steps and all that.
Yes, I see. Now, I've got to ask you a couple of questions. Is the pain on the outside of your knee, on the inside of your knee, on the inner part of your knee facing the other leg, or is it over what's called the kneecap? Is it above the kneecap, below the kneecap? Where exactly is the pain?
That's below the kneecap.
And then tell me, is this pain there all the time, or does the pain come and go, or is the pain only there when you start climbing the stairs or so?
Like I'm sitting now. If I attempt to stand up or anything like that and try to walk off, that's where the pain is. And when I'm climbing steps.
Yes. Now, let me ask you further. Is there pain in the knee as you start to get up, or when you sit down, or as you are moving, walking?
As I'm getting up. As soon as I try to get up, then the pain starts.
Yes. Now, have you taken anything for the pain? Have you taken anything for the pain that seemed to ease it or so?
Well, I went to the doctor here and they got me some medication, but it doesn't seem to be working at all.
Mm-hmm. Now, could I ask you what...
along with some Voltaren.
Voltaren. Now, let me ask you, when you say it doesn't seem to be working at all, did it ease it 10%, 50%, 90%, or has it done nothing at all to the pain? Huh?
I would say like a mere 10, 15%.
That's all the improvement you've had. Huh?
And then start back again.
Yes. Yes. Now, have you been to the doctor only once, or did you go back to the doctor for a follow-up to tell him that the tablets aren't really working, for him to check it out again? Have you done that?
Actually, I called the doctor and they said to me, well, they made an appointment for Saturday to see the bone specialist here.
You made an appointment for you to see what?
To see the bone specialist.
I see.
Actually, I went to get an X-ray on Monday.
Yes.
Last
Yes.
Monday.
Do you know what? That's the point I was going to ask you. Do you know the results of the X-rays at all? Do you know the results?
No, the doctor who did it sent it to the bone specialist and made the appointment one time.
Yes. I want to ask you, how high did you fall? Did you fall two steps of the step ladder, or did you fall, let's say, about 6-7 feet
Just
off the step?
about 5 feet.
My gosh, all right.
About five steps. Yeah.
Yes. Well, that's it. And you're sure you didn't hurt any other part of your body, your head, your chest, anything like that, your arms? It was just your knee and your ankles that were affected, right?
Just my knee and my ankle.
Well, let me say, obviously, I don't have the X-ray available, but I tell you, I could feel your pain, and there is a chance. You see, your kneecap lies within some tissue that stretches from your lower leg right up to your upper leg, and your kneecap is inside there. Your kneecap is really important. Now, if you're having pain below your kneecap, there's a possibility that that tissue was either strained. It's a ligament type of ligamentous type of tissue, and it would have been stretched and torn, possibly, and it's going to take some time to heal, especially as there was swelling. There might be a little bleed inside it. That swelling went down, but it hasn't healed yet. The other possibility, I got to say, is that by falling down so high, almost 5 feet, you may have hit the bone in such a way that there might have been a hairline fracture. Normally, if there's a fracture, you're usually unable to walk, but sometimes you're still able to walk. So that's why the X-rays were important. They would want to see exactly if there is any kind of hairline fracture or breakage of the bone in some way. I think it's unlikely. I think it's more some tissue damage, but I think the orthopedic doctor is going to be the right person to be able to say that. And when did you say your appointment is with the orthopedic doctor?
Saturday.
Huh?
Saturday morning.
Or the end of the month, right? So I wasn't hearing you properly.
He said Saturday morning.
Oh, Saturday morning.
Saturday morning.
Well, and now you're not walking around. You're not aggravating this. You're not going out playing cricket. You ain't running up and down the place, up and down town, and so trying to test it out to see if it's still hurting you. You ain't doing all that, are you?
Well, if I was trained, then I wouldn't be able to move at all.
I think so. I wouldn't mention that to you because at this stage, not knowing exactly, you should not be aggravating it. You should be resting. It would have been good if you would have been able to see somebody earlier, and that this could have been speeded up. And so, because if there is anything like a hairline fracture, they're then going to have to immobilize your knee to make sure you're not able to move it at all, to make sure you ain't running up and down the place, and that it essentially could heal properly with time. They would then also be able to give you some of the right doses of medication in relation to pain if necessary. But since your pain is mainly being caused on standing up, I think they're going to want to not just suppress the pain, because they could do that. They could give you stronger and stronger pain medication. But if there's injury there already, you don't want to aggravate the injury, even though you're not feeling the pain. So the pain is a symptom that there is ongoing injury, and the injury is not healed. And therefore, it's going to be important for you to be able to rest and for this to be taken carefully. Now, today's only Wednesday, And in the next 2 days, it's going to be 2 long days before you go and see the doctor on Saturday. He, I hope, will be able to get a copy of the X-ray results straight away as well, and would not have to wait, and persist this any longer if he doesn't have the results. So it'd be important if the X-rays are also referred to him. So by the time you go to see him, therefore he has all the information available to him. But I want to suggest, rather than you or I or anybody recommend any stronger pain medications to ease the pain, there's an indication that there may be some level of injury and you need to rest. You need to take it easy. You need to be a little out of action for the next couple of days with respect to walking and getting up. Now, at the same time, we don't want you to be totally immobilized, because that could lead to other complications. You don't want no blood clots or so to develop. So you're able to move your feet, always tend to move your toes and so forth, but try not to flex your knees. I think that's the important thing that we want to do. So sometimes we may recommend putting on a knee band around your knee, but I want to suggest
that's the next.
Huh?
That's the next thing. When I try to, I have knee band,
Yeah.
but when I put it on, it's like it aggravated more.
Right. Well, okay. Having said that, you need to relax. You need not to go to work. You need not to indulge in any form of physical activity. And you need to get somebody to drive you to that particular doctor on Saturday so that they could get an evaluation. I wish it was an appointment tomorrow, but the fact that you're able to talk and so forth, it seems if things are pretty okay. And I'd love to follow up on this and see the outcome. Maybe you could call us back and tell us what actually happened. I think it's more going to be tissue damage than anything else, rather than any sort of bone fracture, hairline fracture being a smaller fracture, as opposed to outright breakage of the bone. So let us know, please, what's happening, and I think we need to put it into the hands of the orthopedic doctor. Okay.
Thank you.
Right. Okay. My pleasure. Yeah. Yes. Kamal, I hear, and everybody listen, being online, not physically examining the person, it is often difficult to be able to give proper advice. But today, do you realize at least 50 to 60% of medicine today is being done online? It's being done from a distance point of view. And doctors are using all sorts of sophisticated means to get more information other than just talking to the doctor, to the patient. We're able to get much more. You're able to see me. We're able to use video conferencing to actually, if there's a skin condition, we're able to see the skin condition. If the person got results, they could hold up the results or text it and the doctor could read it. So a lot more is being done from a distance point of view, because, believe it or not, in some parts of the world, there's no doctor. There's no doctor for hundreds of miles. There may be a nurse, there may be someone with some medical experience, but there's no real general doctor. And when I started off, I started pointing out to you about the different ranges of doctors and the OBGYN, the pediatric. Suppose I was a pediatric doctor, and the gentleman who just called there, even though I'm a doctor who deals with pediatrics, I have to still be able to give him some advice. But really, his doctor did the right thing by referring him to the orthopedics doctor, who's the bone doctor, the bone surgeon. And it would have been nice if he would have been able to see the bone doctor straight away within one day. But I want to say it's very sometimes unusual that in some places, they do not have any specialists at all. They do not have any person who is in a specialized area. All they have is a family doctor or a general practitioner, and he's the only doctor for hundreds of miles, especially in areas where there's sparse populations. And so it's not point if there's a neurosurgeon there. He'll only do one case in every month. And he's a neurosurgeon who's supposed to be dealing with 6-7 cases a day. So this is a way I started off to give people the range of different type of doctors. And today I really was wanting to talk more about the psychiatrist, because recently it was said that St. Vincent has not had a psychiatrist on staff for a number of years, or one who came last year left after a short space of time. We have had psychiatrists over the years, very good psychiatrists, but psychiatrists are not just in high demand, but they're in low supply. Doctors have been getting into the more lucrative fields, I would say, of OBGYN and surgery, and some of these specialized areas like orthopedics and so forth. I've got to say that. And the family doctor is somebody who can deal with some psychiatric illnesses, some of the milder mental conditions, but they can't deal often with some of the more severe type conditions that one needs to know about. Now, there is another branch of deals with mental illness called a psychologist. I want to explain this a little bit. Someone can be a psychologist and someone can be a psychiatrist. A psychiatrist is someone who's gone through normal medical training, just like the other doctors, but have decided to specialize in psychiatry. They are a medical doctor, whereas a psychologist is someone who has done a lot of work and even become a doctor of psychology, but is not a psychiatrist. Now, there's a branch of psychology called clinical psychologists. Now, these individuals are just as good as a psychiatrist. They know their stuff, but some of the laws of certain country would say that for someone to be declared as having some sort of mental illness, especially if they've committed a criminal offense, they need a psychiatrist to certify that the person is mentally ill or not. As opposed to someone who is a psychologist, even though they are clinical psychologists. And it depends on the country, it depends on the laws of that country, and usually countries that have inherited the British system, they have a tendency of requiring a psychiatrist versus a psychologist, even though that psychologist is a clinical psychologist. I know I've gotten into a little bit of detail there, but and today I want to really finish off this program talking more about mental illness and really continuing on what I've been talking about in general in relation to the issue that took place, that sad issue took place in Rose Hall, where a little baby, a 1-year-old baby, her life was taken away from that little baby.
You can take the break.
And it is purported that the person who did it would have been on some of the higher levels of drugs. We call it crack cocaine, and that it would have potentially induced a mental illness. Now, I'm talking like this because you know, when something is sub judice and it's going to be a case, you know, one shouldn't discuss the details of the case in the public because it could prejudice the way in which the public, or the jurors, and so forth would think. But it is also my responsibility to start the process of educating people about these type of things. And if people don't know anything about it, we will never end up knowing about it. So let me say, I want to come back and talk a little bit more about mental illness and go through these things in a little bit more detail. So I haven't classified the different type of doctors, and the caller is one who would have seen either his general practitioner or his normal doctor and has been referred to a specialist surgeon called an orthopedics or bone doctor. Then that is the way it's supposed to happen. We sometimes wish it could happen very quickly, that somebody could see the bone doctor the next day, and the person could be out of their discomfort and their misery and their worry and their stress. But you know, it doesn't always happen that way. And there are several bone doctors in St. Vincent and the Grenadines, I must say. Some may have retired, some are still practicing. And it's a good thing that we do have persons who are highly skilled in those areas and can help that person. When we come back, we're going to talk about the more mental type of illness and how they are really classified and how we should look at them a little bit more carefully. So when we come back from the break, we're going to talk a little bit more about mental illness.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, and we're back. And I want to say that general practitioners or family doctors can take care of a wide range of things. They can start taking care of a mother when the baby is still in the womb in the early days, but they will refer to the OBGYN doctor normally. They could take care of young babies most of the time. If the baby has to be hospitalized, a pediatric at the hospital would take over and make sure that that baby comes out back and goes back to that family doctor and so on. And if the person is not a baby but an adult, they can take care of adults too. And only if there's a need for a cardiologist or a neurologist or somebody else, or if there's a need for a surgeon, they would refer to those people to just what I was talking about, the referral to an orthopedics. I'm repeating myself, but it's important. But one doctor in any field often has the experience to deal with a wide range of things. But if you live in what's called a litigious society, I'm going to talk about if you live in a society like the United States, doctors should not usually try to do everything on their own. They should refer. There's a high rate of referral. Get some help. And also, if there is a high rate of people being covered by insurance, medical insurance, then they should be referred also. Because you know that patient will come back, right? Because you have the type of insurance they will come to. Now, on the other hand, sometimes, I've got to say this, when there isn't a lot of insurance about, doctors can tend to hold on to the patient and not make that referral in a timely manner as they should. I say that, you know. Now, the only thing is that one discipline that is highly specialized is psychiatry. And other physicians tend to shy away from psychiatry if it is especially something that is severe, something serious. Let me now just go through the different type of psychiatric illnesses. Let me go. You could say that generally 5 types of psychiatric illnesses. The first is what's called anxiety disorders. This is the most common category of mental health disorder, I think, throughout anywhere in the world. And anxiety disorders can impact 5.5% of the global population. Whether you live in America, whether you live in Africa, whether you live in China, or you live in St. Vincent, it said on average 5.5% of the global population suffer from some form of anxiety. This I'm talking about as 500 million people. 500 million people suffer from anxiety. Now, the second type of disorder is what we call mood disorder. Now, anxiety is a mood disorder, but other mood disorders tend to be the other way. The most important of the mood disorders is what we call depression. And there can be different levels of depression. But one of the big causes of depression is something we call endogenous depression, where people just get depressed. And they get depressed. They get into what's called chronic depression. They're depressed all the time. They cannot function. They put on weight. They become disheveled. In other words, they can't take care of themselves. They don't comb their hair. They don't. Well, I know you're looking at me and see my hair combed and so forth and things like that, but I'm not depressed, you know. But the point I'm trying to make is that depression disorders also is big. It's about 4.5%. Just under 500 million people suffer from depression. And here, what with mood disorders, there can be people who suffer from both. They oscillate between anxiety and depression. There's a form of anxiety depression called a bipolar disorder. It's a mood disorder. They bounce from being anxious to being depressed. The third category is what we call psychotic disorders. Psychotic disorders is one of the more serious type of disorders. And these individuals, they can have something called delusions. They can have thoughts. The psychotic patient start having distortion in their thought process, so that the way they think is not normal. It isn't that 2 and 2 makes 4. And I'm not talking about adding up, but they don't connect things. They see things in a different way. They may have hallucinations. They have what's called delusions. They may start thinking that, I've got to say this, they may think they're Jesus Christ. They may think they are Abraham Lincoln. They may think they're Superman. They may think they can fly if they're Superman. And they can try to jump off of a building because they have a delusion of that particular nature, you know? Now, there's some other disorders. I got to mention the big ones. There's what's called eating disorders. And eating disorders is not just people who are eating too much, but people who don't eat at all. They have anorexia. The number of females who have anorexia nervosa, and they think that they're fat. They have a distorted impression of their body, and they start to think they are overweight, so they are not going to eat. As a matter of fact, if they eat, they may do a very strange thing. They may put their finger down their throat and make themselves vomit to bring back up the food because they don't want to put on weight and make themselves fat. When in truth, they may be only 80 pounds. They may be so underweight, but they have when they look in the mirror, when they have a impression themselves. They think they're overweight. They think they're okay. That's eating disorder. But eating disorders could go both ways. There are people who also eat a tremendous amount of food and they become severely obese and they cannot. And guess what? We even have to do surgery on them. We have to cut out some of their intestines. And so, in order to make sure that they don't absorb the food that they're eating. And then there's a host of other illnesses that I don't really want to get into, but let me just say, there's some mild illnesses, behavioral syndromes, right? There's also sexual dysfunctions, right? There are also habit and impulsive disorders, such as pathological gambling or people who want to set fire, pyromania. You know, there are all sorts of people who steal, we call kleptomaniacs, and so forth. And I could go on and on and on in terms of different types of conditions. And then there are what they call dependent personality disorders. These are people who, they're not depressed, you know, there's a host of things. And then there's a strange set of other sexual disorder we call voyeurism, pedophilia, right? And sadomasochism. I shouldn't really get into all those sorts of these, but I'm trying to give you the range
We have a WhatsApp question.
of illness. Hello?
We have a WhatsApp question for you.
Okay, yes.
Someone is asking, says, good night, Doc. What is the cause of someone not performing as how they should when having sex with their spouse, and what recommendation can you give this individual?
Well, you know, I have to take that question very seriously. I started touching on it because I started mentioning that certain aspects of mental illness can be sexual in nature. And I mentioned pedophilia, I mentioned voyeurism. Voyeurism is people who want to expose themselves in public and things like that. These are various forms of mental illness and is not related to the question you've asked. Let me say that in terms of sexual performance, and I want to say this very, very carefully in terms of some new information that we have been finding out, Kamal. There is a substance called nitrous oxide, NO, that is there present in our blood vessels. And when nitrous oxide is present in high amounts in our blood vessels, it helps to control our blood pressure. The nitrous oxide helps to control our blood pressure. Now, strangely enough, as somebody gets older, the amount of this nitrous oxide starts to wane and drop. And that's why some people start to develop high blood pressure as they get older and older. Now, there are certain foods, spinach, nuts, that are great for helping to stimulate nitrous oxide production and keeping our blood pressure under control. Now, why did I start off with that? Because in relation to the penis, the control of having an erectile function, a proper erectile function, also depends on this nitrous oxide. It depends on this nitrous oxide. I want to tell you that they found out the substance called Viagra Viagra, blue tablet, tends to stimulate an increase in this nitrous oxide compound that only lasts for a certain period of time, but is able to keep the blood vessel constricted tight so as to keep the blood inside the penis, keep it engorged so that proper functioning can take place. It's also known that persons who have anxiety, persons who are depressed, persons who have worries about their life and under stress, they do not have proper functioning. So on one hand, this nitrous oxide thing is something that occurs as it gets diminished as one gets older. It also gets diminished if you're not eating some of the right foods, you know? And it also becomes suppressed by stress and also the anxiety. So if you have financial problems, if you have all sorts of problems on your job, if your partner is worrying you and putting pressure on you and putting, you're not performing, all that is added stress too. So I'm bringing up all those things. Now, the discovery of nitrous oxide is something that eventually led to the award of the Nobel Prize. And so there's a lot of information now available in terms of how we're able to do them. One of the ways in which that individual who may ask that question could improve things is, first of all, getting their partner to understand that there needs to be circumstances where there isn't a lot of stress. It has to be a partnership, a sexual partnership to deal with sexual problems. In addition, it'd be good if that person was to go and see a urologist. I see they could see any of the doctors I mentioned. Seeing a urologist, depending on the person's age, you want to double check that they don't have an enlarged prostate, that there isn't an inflamed prostate, prostatitis. You want to be sure there isn't early prostate cancer and all that kind of things. I doubt that. We also have to be sure that they're not suffering from diabetes and high blood pressure, and they're not suffering from any other illnesses that can affect the way in which there is a sexual function. And there's a way of going about these things. There's a boxes we can tick, and so to make sure. And so this most individuals can be helped significantly, and it's usually going to be issue of whether they haven't been on the right diet, they haven't been taking proper care of themselves, they're under a lot of stress, both physical, financial, and all the other types of stress, and their partner, and so is not working along with them in this regard. And in this way, the need to prescribe one of the medication that helps to boost nitrous oxide, that's Viagra or Elytra or Cialis or one of those type of things. They need to be, we need to check that person out first, make sure they don't have high blood pressure, diabetes, and other things like that first, as opposed to just putting somebody on medication. But I think what I'm indicating is that it's not a complex issue, but it's a issue of going through the steps, step 1, step 2, step 3, step 4, step 5, and we could then possibly find out the means, the way in which this can be dealt with in a more satisfying way, and to restore that very pleasurable aspect of a sex life for the individual. I don't know if I've really answered the question. I don't want to go into all the details without getting a little too explicit in terms of it, but I want to say that we've made some real big discovery in relation to this issue of nitrous oxide and the way it deals with high blood pressure and the way it deals with sexual function. And there's a lot to pick up on this and read about this. And the person should probably do a little reading about it as well. You know? Kamal, I don't know if I've answered that question. Is there any follow-up? Did the person ask any other thing?
The person didn't, but there's another WhatsApp message here.
Okay, yeah.
All right, it says, oh yes, it says, gentlemen, good night. If a person using the blue pill and they have glaucoma, can the pill affect their glaucoma?
I tell you, boy, Kamal, we get some tough questions tonight, boy. We get some tough. I'm getting some fastball questions. They're throwing things at me. For sure, when I mentioned to you about high blood pressure is where the blood passing through your body is like under pressure. You feel like at night in your area, Kamal, the pressure of the water could be high. When you turn on the pipe, you see the water gush out. The pressure could be high, whereas during the day, it's not so high. You know what I mean? I'll give an example. Well, inside your eye, there could be a high intraocular pressure. That's the pressure of the fluid that's actually inside your eyes. Could be high pressure too. And when that happens, it could push on the back of your eye. It could push on the back of your eye where some of the blood vessels are and where the nerve, the retina and all this other thing that sees the nerves that actually picks up your vision. If fluid is squeezing back on those cells, that's what we term as having glaucoma. You understand? There's too much pressure in the eye. It could be one eye, it could be both eye, and you don't really want that. Now, it's always important that someone sees their physician before. In this case, it would be an ophthalmologist, the doctor of the eyes, right? And they will be able to assess what is really taking place. Now, when somebody says they have glaucoma, there can be persons with very early mild glaucoma, and there could be persons who have severe, very severe glaucoma. You understand? And if somebody has a mild condition, I will not withhold something like Viagra from them. However, if it's more severe, then we have to see the risk. We don't want you to lose your eye, in places just for pleasurable episode of sex. So what I'm suggesting is that the ophthalmologist would have to be able to give the accurate reading of how severe that glaucoma is, how bad it is, and to also assess if there's glaucoma, is there also high blood pressure? Is there some other conditions that's also involved, like diabetes and other things like that? And those are questions that when people ask these questions on air, sometimes you don't get all the information. And I could simply say, oh yes, there's no problem. But I don't have all the information because they've not revealed all the things that may be wrong, or that they themselves may not know all the things that are wrong. And also what other medications they are taking. So if they are taking any other medications for high blood pressure, diabetes, glaucoma, whatever, then we want to see if there's going to be any interaction with the blue pill, with anything else. So that's going to be important to know. I want to suggest to that person, they do go and see their ophthalmologist to be able to follow through on this and put those very personal questions in confidence to the OBG, the ophthalmologist, and I'm sure they'll be able to get a good answer in terms of how they should proceed and so forth and how much. Right? This is the way we have to do it. Any other follow-up questions or
The first person who sent the WhatsApp concerning performance says that I don't suffer from diabetes, neither financial problem, and I
Yes.
am in my 49. Well, I guess they're saying they're 49. They're in their
Okay.
40s.
Yes. Yes. Well, can I tell that individual? I'm glad that they do not suffer from those particular things, and that they have been thoroughly checked out. That once again, if they're 49, it's unlikely they may have an enlarged prostate, but they may also have something called prostatitis, which is sometimes an inflammation of the prostate, and they urinate a lot and so forth. And they may not have that. I'm just really suggesting that. I am also making the suggestion that in terms of most problems with sexual dysfunction, it is usually psychological. They need that boost in confidence that they are not going to have a failed attempt in relation to that sort of activity. And the most critical thing is having a willing partner who is going to be able to work with you, who is not going to make you feel there's any disappointment. And so it's important to be able to talk to that particular partner. And through the fact that the partner loves you, they will also be able to work. If they are putting pressure on top of you to perform, it will likely result in your not being able to perform. Whereas if they're working along with you, it's going to be very, very helpful. It's one of the most critical components of these particular type of therapy. There are various mechanisms, and I don't want to go into detail with them on they're all sort of bedroom mechanisms that are going to be able to help. And I wish I could do a program on that. But because we are at 8 p.m. and we're not at 1 o'clock in the morning, we may also have some young children or so who are exposed to this. I could see it after we're on YouTube and so forth.
That's
I may not necessarily, I probably would not be forgiven by certain parts of our community to start going into more graphic details as regards what could be done. But that individual, I'm saying, you can definitely receive some help. That it's something that don't give up at all. And by your calling, it shows that this is something that you have an interest in, and I think it's important to pursue it. And you go to one doctor, they may not necessarily give you the support that you need. But there are various doctors right here in St. Vincent the Grenadines, or if you're not living in St. Vincent, wherever you live, I'm pretty sure that there are doctors who will be able to go through this with you in some sort of detail and help you. And for other persons who are listening who may have this sort of, if you don't have an underlying illness, such as diabetes and high blood pressure, diabetes and high blood pressure will affect the flow of blood to the penis. I'm also suggesting that the type of food that people eat, the foods, you look it up, foods that will stimulate nitrous oxide production or can boost nitrous oxide production in your body. There are even some people who talk about the type of things the nitrous oxide the bacteria that helps to produce the nitrous oxide actually start in your mouth, and are very important there too. That's a long story, but the thing is, having a willing partner who's able to walk with you and go through the various steps is quite critical. And it's my hope that I put you in the right direction without getting into graphic details as regards how things can be done, because I wouldn't know your case, and I'm not necessarily your direct doctor. And I'm really hoping that there's something I'm hoping that things will work out for you, you know.
All right, Doc, we're pretty much out of time, so
Yes, but Kamal,
we need to come
we
back to next.
have we done? Oh, yes, we've done. But next week I'll finish off this thing. Thank you very much, ladies and gentlemen. I know I was looking at time. I thought I had an extra minute to say goodbye. The program coming up. Let me apologize for going over the time. Everybody, do have a wonderful evening and good night.
Your health matters.
How much do you know about what makes up a healthy life?